Hello everyone and Happy New Year. My name's Adam, I'm one of the audiologists at Alto Hearing and I'm back today to bring you another earwax removal video direct from our clinic in Lutterworth, UK. If you are new to our channel, welcome. We'd really appreciate it. If you do enjoy our content, then hit the subscribe button and give the video a like. So we were back in clinic yesterday after a short break over Christmas and it was packed. A really busy day for myself and Mariia, and there were some really interesting cases, a few of which I'm going to show you today in a bit of a compilation. First of all, we had a relatively routine one, but as with a lot of people yesterday, you can see this eardrum is quite dull. So many colds and infections going around this time of year, and we've seen a lot of this. Next up, we had a lady in who had quite a severe tremor. Now, when we're doing endoscopic wax removal, the camera itself is like a very thin metal stick essentially, and then the Zollner tube we use to remove earwax is also thin and pointy, so we have to be super careful at all times. So when you have a client with a tremor, it's so important to make sure the technique involves what's called a brace, which is when you're holding the endoscope and the Zollner tube, we'll be making sure we have fingers rested quite firmly on the client's head. That ensures that if the client makes any sudden movements towards the clinician, then the camera moves with that movement. If you don't have a brace, then you've got the danger of the camera or tube going straight into the ear, causing trauma or even worse, a perforation, and we definitely don't want that. But as you can see, this one went completely to plan and the client was very relieved after, as her hearing aid now sounded so much better than before. Next up, we had a regular client who made his way in to see us. Now, we've had to take this gentleman's earwax out every 6 to 9 months or so, as he periodically notices his tinnitus getting worse when he's blocked up. As you can see, it was dry and dark brown. This normally indicates it's been in there a while. Sometimes people are more prone to building up earwax like this than others. Often it can be age related because the glands in our ears change over time. The oils and secretions in the wax reduce, making it drier, but luckily this time the earwax came out really easily and we didn't even have to add any sodium bicarbonate or anything, which was nice. What we did see with this gentleman though, again, was quite a grey looking eardrum which lacked the light reflex, which is a little cone of light we look for to indicate a healthy eardrum. So after we took the wax out of this person's ear, we did a tympanogram to check the compliance and the middle ear pressure, and it all came back fine, and so did his hearing scan test. So we'll be seeing him again soon just to check things over, but otherwise this was a nice and straightforward one. This contrasts directly to our next one. Again, another returning client. Now this one is one of our hearing aid customers. Actually, I saw him about 4 or 5 months ago and found a fungal infection in his left ear, which was referred and sorted with Otomycosis spray, but he was back in today with a bit of pain in his right ear, and as you can see, it is looking a bit red in there, and there's definitely the appearance of little spores. It's like fluffy cotton-like growths in there, and the presence of white and black colours indicate that this is likely to be Otomycosis, but it will have to be confirmed by his GP. Now, when you have a fungal infection, it can be quite uncomfortable. Often there's a feeling of itchiness and a feeling of fullness in the ear. So why do we get these fungal infections? Well, firstly, the ear canal itself is nice and warm, and if there's enough moisture in there, it makes an ideal environment for fungal growth. Fungal spores are everywhere in our environment, in the air we breathe, in the dust, and sometimes on things that we touch. So it's not unusual for them to make their way into ears. Now, most of the time our bodies are great at keeping these spores in check. Our earwax and immune systems work together like bouncers at a nightclub, keeping these spores from causing any trouble. But sometimes, if the conditions are just right, like if our ears are moist or if we have some irritation that weakens our ears' natural defences, then these spores can start to grow. So we removed as much as we could there for this client and then referred this straight to the GP, who will take a look at it and prescribe the correct treatment. So that's it for today. Please do give this video a quick like and subscribe to our channel for more earwax removal content coming your way very soon. Take care.